Ethics in public health. We all know the Nazi Germany actually violated the human rights and they did unethical research which was condemned worldwide. Later on, Declaration of Helsinki by World Medical Association, Belmont Report by US National Commission for Protection of Human Rights, CIOMS, Council for International Organization of Medical Sciences. So all these agencies and reports, they created a proper ethical guidelines for conduct of research without violating the human rights. So these are the four cardinal principles of ethics. First one is the beneficence. It is the moral responsibility of the physician to act for the benefit of the patient and to avoid unnecessary harm to the patient. Non-maleficence is almost the same. The moral obligation of the physician not to do any harm to the patient, volunteer, or participant. That is non-maleficence. It is the duty of the physician to weigh the benefits against the all interventions and treatments given to the participants, whether it is of benefit to the society. That's what the physician will see, and also he should not do harm to the patient. So there should be a balance. Autonomy, this is the most important ethical principle, and that is the participant or the patient has the right to participate or right to withdraw from the study. He has full right. Yeah, he may withdraw from the study even if he doesn't like. There need not be any valid reason that I don't. That I'm suffering from this particular side effect, this problem. No, even if the patient or volunteer doesn't want to, his mind is not inclined towards it. He should have full autonomy to withdraw from the study. Justice is usually interpreted as fair, equitable, and appropriate treatment of persons. So the justice is served, which is fair and equitable. In addition to these four cardinal principles, there are also other things like informed consent and confidentiality, non disclosure of the patient details to anybody. So, these are all very important in doing research. And when we come to ethics in public health, see, there is always there will be situations where you cannot follow all these ethical principles. Like Oxford textbook of public health gives three scenarios under which there will be a delicate balance between ethics in public health, between maintaining the ethics of the patient and protecting the society. For example, the HIV patient, you are doing a research and you found that he is HIV positive, but the patient has participated in the study with the confidence that the researcher will not reveal the detail that he is HIV positive to anybody. So, in this situation, what is the ethical problem? The HIV patient, if you don't reveal it to the family, then the wife may get HIV positive. The children will be born with HIV positivity. So, the society is at risk because you are protecting the ethical principle of the patient. So, in this scenario, how will you balance this situation? This is one ethical problem in public health. Second scenario is typhoid Mary. The Mary insisted that even though she is a typhoid carrier, she insisted that she wants to continue her job as a cook, and inadvertently the typhoid epidemic started because of typhoid Mary. So you have protected the rights of the participant, but the community at large has got affected because of this decision. Again, there is a delicate balance. A third scenario is there was a prophylactic treatment for HIV infection. A research study was going on in Cambodia among the commercial sex workers. And the president of Cambodia abruptly stopped the study because he felt that the sex workers are being exploited under this research design. So he felt like that and he abruptly stopped the study because he has all the powers. A president of a country has all the powers to stop something which is happening in his country. So this is an unfortunate situation which could have been avoided if the researcher clearly explained what is the reason for conducting this study and what is the overall benefit for the community. If it was properly communicated before, maybe this could have been averted. This is another problem, a public health problem, where the political interference can influence the ethics. So, like this, there are numerous ethical scenarios where we have to delicately balance the confidentiality, the autonomy of the patient, the benefit to the community, the benefit to the patient. So, there is a delicate balance, and it is the duty of the ethics committee, institutional review board to see what is a risk, less than minimal risk, more than minimal risk. So these things, the risk category will be decided by the ethical committee, based on which the research will be permitted to happen or maybe stopped.